A great start is all your kids need to shine. And when there's a tasty start to the day, there's nothing but joy in your home. Give your family a head start with a scrumptious range of Start cereals. They're nutritious, packed with fiber and energy, and such an amazing taste that everyone will start to dig in. It's the only way to start your day.
Get your child's day started with any Start cereal. Enjoy yummy flavors like banana strawberry loaves, cocoa balls, frosted cornflakes, Jolly Roger, caramel pillows, banana cream pillows, honey cornflakes, and cocoa pillows. Taste and see the difference. For wholesale or retail, contact AA Global Enterprise at 124 Kissy Road, Freetown, or call them on 079 538878 or 099 772 553. Start cereal. Taste crunchy, taste yummy.
You are watching AYV Television.
Hello, this is News Brief here on AYV TV and Radio 101.7 FM. I'm Naomi Kamara. Don Bosco Fambo has officially launched the Left Me Body campaign at their 4th Street office in Freetown. This, according to the advocacy officer Ibrahim Toure, is to help raise awareness about sexual exploitation, especially amongst minors across the country.
The campaign is a sexual exploitation campaign. We want to launch a campaign, raise awareness about sexual exploitation, especially among minors. We are looking at how children should have the ability to reject some of this potential exploit. People want to exploit them. That is why we are training 50 schools in Freetown, primary 6 girls and boys, because we are looking at SGBV, boys and girls in the minors. The ability, we are training the skills and ability to say no to some of these things. Because it's not always about you saying they are forcing girls or boys to make them look honorable. We are looking at people to see themselves to be strong figure who can always say no to these things. Except this, of course, for children, there's no consent about it. But once we see a society where children have the confidence, they have the assertiveness to say no to some of these things.
The chairman of Constituency 110 of the Sierra Leone People's Party, together with some members of the Tokendu Attire base in Adonkia community, have donated 250 sets of school uniforms and other learning materials to pupils of REC Primary School. According to Chairman Barry, it is in line to support President Bio's free quality education program in the country.
REC School forgive that kind of donation because we believe in the president's ideology. We believe that when you get manpower, that purpose will go down. Because if we begin now man book, you set like gymnastics. That picking them, we will help you for like go America, we will help you for like the other thing. As chairman of this constituency, we need to embrace, we now all, now embrace the free quality education. Where one day in our life in the history of Sierra Leone, will not happen it. This one, what the president do?
Fine, because some of them stand for uniform. Some people are single parents, they stand for uniform. They can't be uniform today. We're glad for that. Mr. Barry,
so glad for this wonderful opportunity. So now free repeating and I wear change uniform and they wear for school. But I advise the company parents then. As they don't come today, talk and do attire base and don't care, don't come for that supply with this uniform. Do you know we don't left the uniform, you give them picking them. Because that picking them don't know how for handle them. When you picking come to school, put them for them and wash and fine and gun, iron them, you go use on the next day for school. I have to tell you, able, chairman.
Wetin dem don do for we pikin dem, we dey tell dem plenty thank you. And we dey tell Mami Salone plenty thank you. We dey tell we chairman, Mr. Barry, thank you. And we dey tell we headman plenty thank you because it don't need the effect so we pikin dem at this school year so then we begin again knowledge at this school year so we dey tell them plenty thank you.
Still in education, Mentaba Village, Karine District, gets its first primary school after 187 years when this community was founded. An education project initiated by indigenous would avail learning opportunities to children not only in this village but neighboring communities as well. Abasise witnessed this event and now reports.
187 years past today, we begin at this town and the surrounding, they get access to education at the doorstep than a 460. It means for 187 years, all the beginning, the great to forefather, the grandpa, they will be there, then they work at distance for access primary education. Some they work at 14 miles per day, some 10 miles per day, some 8 miles per day. We make illiteracy rate very high in this part of the country. So, with the blessing of the community, few people here will support to our state letter, and largely by Bologna, we don't make history today for bringing education at the doorstep of the deprived community. We don't go for 187 years without access to education at the doorstep.
Now that they could not come see them, cannot come open this school. We're still glad because that school, you know, she even shakes them. At the beginning, they open this school, when they attend this school, they come out various villages at the past speakers, let me say. Not only Metaba, but we get Rokunga, we get Mafabunaya, we get even Maron now, Madina, Mafori. All that began here in the Komot Kaya. We were about 3 miles now off, instead of 7 miles with them they talk off.
The first ever reggae music festival in Sierra Leone with the theme Make Sierra Leone Green is set to make place in Freetown before this year ends. The aim of the reggae music festival, according to the organizers Ripstar Culture Sierra Leone, is to raise awareness on how we should treat our environment, climate change, and its adverse effects on humanity. In a press release, Sori Obai Kamara, aka Obi Phrase, Chief Executive Officer of Ripstar Culture, said Sierra Leone is ranked as the world's third most disaster-prone nation with already telling impact. Albert George Sharif witnessed the press briefing and our reports.
Our responsibility to educate our people on steps to be taken in mitigating those environmental hazards surrounding climate change. According to research on global climate change, Sierra Leone is named as one of the countries that will suffer from future climate disasters. We have decided to have the marginalized reggae musicians and dancers spread this message through songs, dance, and live band performances. Let us plant more trees, stop cutting down trees, extinction of animals and insects, and embark on clean agricultural practices for food sufficiency in our beloved country.
We don't be marginalized for quite a long time. And me when they talk so, when the 11 years war come, Pastor Ronald Guinea, we suffer. Music not they go with war, or music not they go when there is a pandemic. Even this last one when a corona, we still they suffer because nobody care about we.
National Civil Registration Authority has held a one-day consultative meeting with the local and tribal heads of the Western area on the needs to strengthen births and deaths registration in the country.
The process of legal review of the NCI Act and the data protection law we are developing in this country has commenced in earnest. Commencing in that, we owe a lot of gratitude as a government to the European Union for leading the process of reviewing the act and even further drawing the attention of government and all the partner stakeholders to the challenges we have in implementing the NCRA mandate in this country. Of course, the recommendations from the Electoral Observer Mission of 2018 elections complement earlier assessments done.
All to the Ministry for the second CRVS Steering Committee meeting this year. As a governance outfit, the CRVS Steering Committee is vital for ensuring that the policies and systems for CRVS meet best practice, standard, and in purpose as well as in practice. We are here today to make our valuable inputs into the legal reforms recommended in the civil registration policy, the comprehensive country assessment conducted in the 2019 and the 5-year strategic national plan 2019 to 2023.
22 Sierra Leoneans who were jailed in Guinea-Conakry have returned home after spending over 10 months in prison. These young Sierra Leoneans, who were accused of being rebels, were freed by the current military government after the overthrow of former President Alpha Condé.
From next day, November 5 last year, 2020. So from Mamu, the Keruguna Kinda, from Kinda and Fiscal, the crowd between Conakry, the Keruguna, the CID, the biggest CID in Conakry day, we did about 6 days. We did a CID investigate we. They no proof, no right for say we are a rebel or whatever, but accuse you say we are a rebel. So they take instance because the leader who gets now when the vice president when Julia Jallo, she can't be done go G3 to the max and say that flaman for win. Then he says Salo will all day for that flaman. So that man we don't get that my art. So they go only from there and courts and can we go. From court, a priest will find himself.
All gone, they crack and pie, they push you, they knock you, they beat you up, say you need for talk, waiting you not do. So we come mamu, even it's outside and say this nice cell, like place where we say it not be too nice, cold. We all cry because we need help to that day because we take us say the money tell them deport you back now the country, not knowing that they count you in a prison. Whatever move where they take, now net, they never work out with something. They try for ask the proper government so that we can aid and try for help you. Because as for now where I come, now too close, maybe they get right now. Food no day, they all meet me family, you know, waka, you know, tell where to.
No carries now, they don't come with nothing. And some of them can't meet them people, they don't die. Even shelter, place for sleep, they don't get. So they cry to the government, let them say how best and cable come inside for help beyond Sierra Leonean borders there. Because at the time these will need them most.
That's all we have for you in this edition of News Brief at 1 p.m. Up next is This Day with David Remy Wilson. I'm Naomi Kamara. Many thanks for watching and listening.
Get all your breaking, factual, and balanced local and international news from AYV Direct to your mobile phone via SMS. To subscribe on AfriCell, send star to 298 and stay connected for only 300 leones per day. Get all your breaking, factual, and balanced local and international news from AYV Direct to your mobile phone via SMS. To subscribe on AfriCell, send star to 298 and stay connected for only 300 leones per day.
Hey, buddy, now story I go so. Hey, buddy, I want to engage this weekend, so I go buy plenty new series in they don't come out. Hey, you still the be and encourage for you season fin there. Hey, buddy, wait for do. Salon or the act season fin. Who that tell you so? You know yet, but we all salon season fin more than call Purian. Hey, buddy, I don't know part what you tell me so. But you be you know what? I don't forget the plate. Then go to play on AYV TV every Fridays 8 p.m. on channel 33 and every Sundays 9 p.m. on channel 34. If Salon on be active with him, one need for the what for in season. I think it's item master for promote to be your salon season. You know what? It's late. I don't know. Papa, make it. Go. Me family then. Charity begins at home. Unale we promote your local film then a salon. Watch out for Puri and TVCs on AYV television.
Inside this season film, you go no say Salon Sabi and then get for the show na in Salon Sabi TV. When AYV television every Friday on channel 33, 8 p.m. and every Sunday on channel 34, 9 p.m. So make you no left piano for waiting AYV films. Don't bring the salon.
Buddy, now story I go so. Hey, buddy, I want to engage this weekend, so I go buy plenty new series in they don't come out. Hey, you still the be and encourage for you season fin there. Hey, buddy, wait for do. Salon or the act season fin. Who that tell you so? You know yet, but we all salon season fin more than call Purian. Hey, buddy, I don't know part what you tell me so. But you be you know what? I don't forget the plate. Then go to play on AYV TV every Fridays 8 p.m. on channel 33 and every Sundays 9 p.m. on channel 34. If Salon on be active with him, one need for the what for in season. I think it's item master for promote to be your salon season. You know what? It's late. I don't know. Papa, make it. Go. Me family then. Charity begins at home. Unale we promote your local film then a salon. Watch out for Puri and TVCs on AYV television.
Inside this season film, you go no say Salon Sabi and then get for the show na in Salon Sabi TV. When AYV television every Friday on channel 33, 8 p.m. and every Sunday on channel 34, 9 p.m. So make you no left piano for waiting AYV films. Don't bring the salon.
Alright, good afternoon, welcome to this day on AYV television, channel 33 and on the radio 11.7 FM. Many thanks to Naomi Kamara for bringing you news brief. This day as usual, news and current affairs show that brings news to your doorstep, and you can also be part of the show by joining the conversation on our Facebook page, the Africa Young Voices Media Empire, where you shall drop your comment and we'll definitely find time to read them in the program. And in today's edition of the show, we shall continue the conversation on the International World Pharmacist Day, and which was commemorated on Saturday. So we're going to look at the content of it. We look at the theme, which speaks about pharmacy, always trusted for your health. And in the studio to discuss it, I've been joined by Dr. Wisha Johnson and pharmacist Samuel Saidu. Gentlemen, good afternoon. Welcome to the show, Doctor and pharmacist Saidu.
Good afternoon.
Good
afternoon, viewers.
Yes. Okay, Doc, I'm going to start off with you, and let's look at the importance of the day and how significant is this day?
Well, the importance of commemorating World Pharmacists Day is attributed to the role that pharmacists play in the communities that we serve. I mean, as you are aware, the first point of call in most communities when people get sick is the pharmacy.
Yeah.
I mean, it's unfortunate that we do not have enough pharmacists in the country. But days gone by, and in many other countries where pharmacists are readily available, you fall ill, you look for paracetamol.
Yeah.
Where do you find it? You find it in the pharmacy. So pharmacists play a very, very important, vital role across the three levels of healthcare. That is the primary healthcare role, tertiary and secondary. Playing, in fact, the role of the pharmacist is one of the most diverse in healthcare delivery, because we cut across from clinical practice right through to administration, research and innovation. And this makes the pharmacy profession within healthcare delivery one of the most dynamic, because diseases are changing every day, and every time there's a new problem, we need medicines. And who is at the forefront of medicines development? Pharmacists and chemists. So this is why the world all over, the World Pharmaceutical Federation, the WHO and other healthcare stakeholders have decided that it is important that we commemorate the day and celebrate the work that pharmacists do in contributing to public health.
Like you said, pharmacists are the first point of contact, more especially in the deprived community, despite, like you said, we still have challenge with regards to having more pharmacy and in some deprived communities, being that they are the first points of contact. But the area of professionalism is also very important, and into that aspect as well, maybe prescribing drugs for someone, maybe the person is being healed. And also, there is this question I asked on, I think it was on Thursday or so, I asked Dr. Sandy about, and it speaks about pharmacists are going to do, like for checking you, going to the pharmacy, they will check you, they will know what's actually wrong with you. And these are jobs done by the physicians as well. And I was asking him whether the pharmacists are going to take over a job from the physician's hands.
No, not exactly. You see, the role of the pharmacy professional is so diverse. You see, today the traditional role of pharmacy has changed. We have moved away from being a product-oriented custodian, i.e. a storekeeper, to somebody who delivers a service. You see, one of the most important attributes about medicine is when you deliver a medicine to the person, you must also have the capacity to show that patient the information that they need to take that medicine properly. Because if you take a medicine and you don't take it properly, it's a problem. So the training of pharmacists has evolved from a diploma in pharmacy or druggist dispenser to diploma, and today we have what we call PharmD. The basic qualification of the modern day pharmacist today is Doctor of Pharmacy degree, and that incorporates a lot of clinical care. And of course, notwithstanding that, there are different levels at which pharmacists serve. There are also different levels at which a pharmacist can perform. I mean, in the ideal situation, clinical pharmacists, that is the doctors of pharmacy who you're talking about, would have a level at which they would stop. I mean, even within other medical settings, like for example in Sierra Leone, we operate predominantly a primary healthcare service. So you know that throughout the country, you have tertiary level hospitals like Connaught Hospital, district level, which are secondary, and then there's the primary healthcare. And this is why I say the pharmacists play a very important role, because you walk into the pharmacy when you have a problem. It is the level of success of your treatment is going to depend on the quality of the pharmacist that you meet there, because the pharmacist is trained up to a certain level. Beyond that level, he should know when, where, and to whom you should be referred to. so that you don't overstep your boundary. And it cuts across not just for pharmacy, even in nursing. I mean, in the developed world today, you have what you call nurse prescribers, as you have pharmacist prescriber, but there's a level which you stop. Where, because, I mean, let's face it, all over the world, we do not have enough physicians.
Yeah.
So all of these healthcare professions have evolved to fill the gap wherein nurses, doctors, pharmacists work together as a team. But since most often the pharmacist is the first point of contact, that pharmacist is now trained clinically to be able to manage certain minor ailments. So it takes off the burden from the everyday physician to be able to focus on more difficult and more important cases. So it's not that the pharmacists are taking over the role. I mean, it's like saying doctors who dispense medicines.
Yeah.
Most doctors today, when you go there, they have medicines. It doesn't mean they've taken over the role of the pharmacist. In fact, by law, they are licensed. You have to be licensed to be a dispensing doctor. Likewise, you have to be licensed as a clinical pharmacist to be able to attend to certain clinical cases. You know, unlike it requires a certain special training. The difference between the training as a clinical pharmacist is 6 years, whereas the regular pharmacy training course is 4.5 years.
Okay. All right. I'm going to come back to you, Dr. Wisha. Let me bring in pharmacist Samuel Saidu into the conversation. The team speaks about pharmacist, pharmacy always trusted for your health. And how can we narrow that into a conversation, more especially into Sierra Leone? Because it speaks about professionalism, it speaks about trust. And, you know, like most people do believe buying drugs outside to drugs peddler instead of them going to the pharmacy to buy their drugs, because they have this perception that, okay, I can just go to someone at the street and then buy my drugs because I believe, you know, they can easily get me the drugs.
Yeah, absolutely. I think the theme itself for this year is very important. Like you said, pharmacy, always trusted for your health, is an important theme. And like you are now trying to merge it with issues of drug peddling.
Yeah.
I will tell you for sure that even the individuals themselves, I mean, us as people within Sierra Leone contribute to poor health system. You know, because you can definitely say you can easily buy paracetamol from the drug peddler, but if you go to the pharmacy, you are going to have a different kind of service compared to the service that you get from the drug peddler. That's one. The second point is the effect of the paracetamol, you will not tell if you buy it from the street. It's not regulated. No one is regulating their activities. You don't know where the paracetamol is coming from. It can be counterfeit medication, and you never know where those medications came from. So, but if you go to the pharmacy, and one thing people have refused to understand is we have, like Dr. Johnson was saying, as physicians are less in number, you know, pharmacists are also lesser in number. Yeah. If you go to, for example, Bo district, you might only find one district pharmacist and one hospital pharmacist that serve the government of Sierra Leone health system. So 2 pharmacists in the whole of Bo district. How will they serve the population? So now what I am saying is, if you go to the pharmacy, what you will first ask for is either the pharmacist or the pharmacy technician. One of them might be available. Then you can talk to that professional for advice on any care or service that you want to be delivered. But if you go to the street, you have health implication because the drug might react on you. You have cost implication because when it reacts on you, it might require more cost for you to go and seek further health care. Yeah. It may also have even other debilitating, like you can die because you have nobody to hold responsible. But if you buy a medication from a pharmacy, registered and regulated pharmacy around the country, you go there and ask for a professional, you can always come back and say, hey, this drug that was sold to me, this is what happened to me. So you have to trust the pharmacy professional to deliver service for you. So that is why they are saying, we are always trusted for your health because we deliver quality service in terms of medication, advice, and also follow-up.
Like for instance, you know, if you go to most pharmacies and then you took your prescription there, which has been prescribed by the doctor for you to go and buy these few medicines. And sometimes if you go to the pharmacist there, you know, instead of him or her go to the prescription, you know, checked whether maybe it also can ask you, you know, the reason of you taking these drugs, despite it has been prescribed by the doctors. Maybe can run through it, you know, ascertain whether it's also matched with what you are actually asking for. And before, instead of giving you the drugs, you know, this is my prescription, I want all of these medicines, and they will give you, instead of them asking you, okay, let's see if this is okay, you know, something like that.
Yeah, so this is what happens in an ideal situation. And I will tell you for sure, those services are being delivered. I can count a number of pharmacy outlets where you can go and you can get very correct services. There are still challenges for sure.
Yeah.
But I will tell you, when you go to a pharmacy, the ideal situation is the pharmacy professional will be giving the prescription, probably from the technician, from the counter, then to the pharmacy professional in his or her office, and the pharmacy professional can go through the medication. There are classes of medications. So we have class A, class B, and class C. So for class A drugs, they are mostly dispensed under, always dispensed under prescription.
Yeah.
Without prescriptions, they are not supposed to be dispensed to the patient. So when there is an issue on the prescription, I feel that as a professional pharmacist, there is an error with, or there is an issue with the prescription. The prescription is written such that the prescriber's information is boldly written.
Yeah.
The name, you know, the contact, and some other few information. I can call back and ask, hey, you prescribed this medication for this individual, but I feel that A and B should not be given together. Or if he or she is taking A, it should not be taking B. Or if you are taking it, it's if you have this kind of interval, or the dosage is too much, or these medications can maybe have adverse drug reactions on this individual if they are taken together. So there are a lot of, that is the ideal situation. And you can say, like I said earlier, the pharmacy professionals are very less in number, both in public and private. In fact, if it is worst in the public.
Yeah.
I mean, for the government service, it is worst. Because you go to certain hospitals, you only find one pharmacist.
Yeah.
And the hospital require the service of the pharmacist 24/7. How can one person actually deliver that service?
So that's a question I'll bring to Dr. Wisha, because you have been in this game for quite a long time. I know there are a lot of challenges faced by pharmacy profession, you know, in Sierra Leone, and you know, which boil down to the manner which they have been treated. For instance, you know, there are certain grades, you know, should be employed, more especially in government level.
Government is just one of the employing agencies for healthcare.
Yeah.
And challenges faced by them would be best answered by people working in that service. But before I digress, I'd just like to add to what my colleague Samuel Saidu, because it's very important. You see, the state of health in Sierra Leone, as reflected by our health indices, maternal mortality, child mortality, life expectancy, I mean, is very low and alarming. Of course, there are a lot of socioeconomic issues surrounding that in terms of other factors that affect health, in terms of wealth, nutrition, etc. But we as human beings play the major part of it. And one thing I can say is the bigger challenge we have, not just for pharmacy, but healthcare in general, is the level of health literacy. And this is one of the things that is driving drug peddling. I mean, when we talk about drug peddling, for me, it's something I've been passionate for the past 2 decades about. I can't understand why an individual, forget about the illiterate or the semi-literate people, you will see well-educated individuals. They will leave all the facilities that government have provided, all the legally licensed clinics and pharmacies. and you will see them buying medicines from drug peddlers. It's amazing. So what does that tell you? It means the level of mediocrity with the way we handle our health is of concern. That is why our life expectancy is very low. Because most of the disease that we die from in this country are preventable. So it has to do with health education. And this is something we need to take as a priority as a people. Because people believe that I can take 2 capsules of antibiotics and get better. In actual fact, the less privileged people think that if I buy from a drug peddler, it's going to cost me less. On the contrary, no. Because you will buy an average dose of an antibiotic, let's say amoxicillin and clavulanic acid, or amoxicillin and cloxacillin, would cost you 15,000 leones for the dose. That's 20 capsules. The average drug peddler would sell 1 capsule or 2 capsules to you for 2,000 leones. So imagine if you multiply that by 20. So the drug peddler ends up making more money. They do not pay tax. They don't pay any form of service fees to the government. And they are growing in strength. So at the end of the day, they have the resources to be able to make themselves present in the community and also to even overwhelm the former services. All right? Of course, we understand that there are challenges with regards access to health facilities, particularly among the communities up in the hillsides. And these guys are like the Chinese footmen. They walk, they move around.
Yeah.
But it boils down to us. You can, because the importance about medicine, what makes them special, it is not just to buy them, but you require information to use them properly for you to get better.
So probably
and somebody who is not educated in medicines, it's like going to buy medicine, somebody does. How can you be buying medicines from somebody who doesn't know anything about the medicine?
So this is about the access. The accessibility is quite very limited, like you said, because those who are on top of the hills, for them to have access to pharmacy, it's quite challenging. So they prefer seeing, a whole man walking towards the area with a box of
but
medicines.
Again, I must intervene here. Over the years, government has put policies in place to ensure that for the most basic medicines, you can buy them in the communities. That is why the pharmacy board issues what we call a patent medicines license, where you can go to a supermarket, you can go to a Fullerman shop, you can go to any small store, you see them selling basic medicines that you would need. If you are really sick and you want to be responsible for your well-being and for those of your children and peers, you should go to a formally recognized health service. It will save government millions.
The awareness is low, doctor. And
that's why I said
like
health literacy.
Yes.
But we've been saying this over. The awareness is low, but at the same time, we need social reengineering. The knowledge is one. The attitude is one, but the practice. In Sierra Leone, we believe in half measures. And sometimes the regulatory component needs to be a bit stronger. But in the environment in where we find ourselves, sometimes it is difficult to implement certain regulatory measures. A once powerful international leader once said, we do not need strong governments.
Yeah.
What we need are strong institutions. And the institution is not just about the government agency or the police or the military. It's about the institution at the community. So it is high time we get involved at the ward level, at the community level, to strengthen our healthcare education interventions, telling people about the irrational use, the dangers about the irrational use of medicines.
Okay, let me quickly run through some messages on our Facebook page. I think we have a few of them, which maybe doctor and pharmacist Saidu can respond to. Jabati Mambo again saying, outtrained our pharmacists around the country. What about those pepper doctors around the villages? Swissman is saying, you will see someone will take malaria treatment at a cost of 250,000 leones. Before 3 months, he must feel sick again because the treatment is not real. Swissman again is saying, what is the role of the pharmacy board when there are lots of fake and expired drugs all over the country? What the pharmacy board should do to stop the entry of fake drugs in the country. I think there's a few comments we can go through, and then let's see if we can get more of that. I don't know who wants to take the bite. Doc, you want to I know, because it comes into
some of these are beyond my current reach to be able to answer. However, I mean, in terms of training, we can assure the Sierra Leonean community that the College of Medicine, I mean, by the way, I am one of the first graduates of commerce. We graduated some 2 decades ago. And as Saidu said, we still have a challenge in terms of health personnel. I mean, when I graduated, there were 5 of us in class. And at that time, there were only 5 graduate pharmacists in this country. We've come a very long way. We have been training pharmacists since that time to now. Today, we have nearly 300 pharmacists and about 600 pharmacy technicians. So we've come a long way, but we still have a very long way to go. But most importantly, we have pushed the undergraduate training. We are now developing. Recently, the president launched the Sierra Leone Postgraduate College of Health Specialities, of which the training of postgraduate pharmacists is also to be included. So now we are now moving to the next level. I mean, the law to ensure the Postgraduate College of Pharmacy, Medicine, Dentistry, and Nursing was passed some 5 years ago. But we are now launching the college. So hopefully, after undergraduate training, we are now creating the opportunity for the specialist training of pharmacists. I mean, we are looking forward to the establishment of pharmacy training schools in other parts of the country, because College of Medicine alone cannot provide the manpower that we need. I mean, you can imagine that there are one pharmacist for about 80 to 90,000 Sierra Leoneans. The figures for medicine is also the same. For nursing, it's slightly better. But for doctors and pharmacists, we need to train more. We need more training institutions. But I believe these are all evolving over time. At least we now have a postgraduate training college, which is now going to start training postgraduate health specialists locally. With regards malaria, again, the person who may have sent the message, with all due respect, there are various scenarios. I am not aware of any malaria treatment, individual treatment, that costs 250,000, unless if he was in a hospital, they paid hospital bed fee, and they possibly administered intravenous fluids. But and what you all understand is, Sierra Leone finds itself within the malaria belt. And based on the epidemiological findings, the average Sierra Leonean is exposed or has the tendency to acquire malaria about 3 to 4 times a year because of the change in season, increase in mosquitoes, etc. But on average, if you do take your medicines properly, even when you take a good quality medicine, what I'm saying here is, and you get well, as long as you are bitten by a mosquito, you are going to get the malaria again. All right? Except if you are taking certain medications that have a longer half-life. There are certain anti-malarials, you only need to take them maybe twice a year, but they don't cost 250,000.
I know.
Now, the issue of pharmacy board and fake drugs, I have experience in that because of my work that I used to do. And the fight against fake drugs is not a fight for the regulatory body alone. It requires the effort of all. And it's an issue of supply and demand. If you do not demand it, there will be no supply. So if you don't go to buy cheap drugs, because fake drugs are most often cheap. If you don't demand cheap and fake substandard drugs, and if you do not, as Samuel was saying, most of the drugs being sold by drug peddlers are either drugs that have been counterfeited, or they are drugs that are normal drugs, or you see some genuine labeled drugs on the market. But what has happened is those drugs have expired. They have a way of changing the expiry dates, and they will go and sell it in the streets. And so you think it's cheap. Oh, but this same medicine, they sell an at 2,000. Why going to pharmacy at 5,000? Well, now they expire, why you take? What do you expect?
And also, the pharmacy board also with a press release with some few, painkillers for I think it's Buffane, or there's this painkiller tablet also.
Again, you see,
and so it asks the question, how does these drugs came into Sierra Leone, and after it has been cut across the country, that is the time we picked it up. That
our biggest problem is the porosity of our national borders. Unfortunately, we are surrounded by countries whose regulatory system is not as strong as ours. The pharmacy board has been built over years, and at international level, it has gained a certain level of recognition. Now, if you are surrounded by countries that do not regulate medicines properly, and your borders are porous, as can be seen. I mean, it's like rice. we produce enough rice in this country to feed ourselves, but all of it is smuggled out.
Yeah.
So it's a negative feedback cycle. People come here, they buy our goods, smuggle them out, they go and buy fake drugs and come and sell them to us. So we keep on killing ourselves slowly. So it boils down to the fact that if you don't buy the fake drug, or if you don't buy drugs from illegal sources, they will not bring them to sell. So that's why I said from the outset, based on my experience working with Pharmacy Board previously, and now, health education is key. And we have to start from childhood. We have to start from the schools. We need to go down to the villages, because by and large, healthcare facilities are available out there. I mean, even in the communities, every 2 to 3 kilometers, there's a government clinic. And there is no community today in Sierra Leone where you will not find a licensed pharmacy outlet. Either it's a pharmacy, a drugstore, or a patent shop. So it is really up to the people to decide to access things from the right place, rather than sitting down and buying it from a cheaper source, because they believe they will save money. But in actual fact, they are spending more. It is just that they happen to be spending it over a period of time.
Okay, I'm going to come back to you, Doctor. So let me bring in Saido into the conversation. Most people will tell you that going to do a pharmacist course or going to do something about the medical field, it's quite very strong, and the course is very tedious, and people prefer going to the other causes. And so how can we manage that for now? Because we want more people to go in for the cause, ensure that we have quality, despite encouraging people to go for the cause, but also the quality should prevail.
Yeah, so it's a matter of choice, and also kind of an issue of somebody's decision, an individual decision. I will make this scenario. Now, if I decide to go and do a course in the 4 years, a 4-year course, and I decide to do alternatively, somebody decide to do pharmacy, which is 6 or 7 years course, and you graduate immediately after 4 years, then you sit for over a period of 6 years or 10 years without sober job. What is the difference if you do the 6 years course and you are employed over your lifetime until you die? So you have to understand. So it's still about somebody's knowledge, understanding, and education. So I will tell you for sure that pharmacy is not cheap and it's not easy. So you have to spend money to do the program, and you also have to spend it over a period of time. So you have to spend time, you have to spend financial resources as well. So you have to be devoted and put your mind focused that this is what I exactly want to do. But I will again say, if you do it and you are successful, like myself or Dr. Johnson, you will be employed over the period of your lifetime. Because as a pharmacist, I definitely have secured job throughout my life. Okay, and I am also able to do my job diligently and in a way that I'm satisfied. Because if you come to me, I talk to you about a particular medication, I advise you properly on how to take it, and you go and take it as I said, and you get well, then I feel satisfied that I have restored your health. So it is a matter of really making an individual decision. But you have the money, and you are also satisfied personally that I am restoring the health of individuals as well.
Because it's very important. Collaboration into the medical field is also very important. Like you said, you have different categories. You have the doctors, you have the pharmacists, you have other sectors as well. So how can we ensure that we see that kind of collaboration, and we link it to the team, which speaks about you should always trust the healthcare system?
Yeah, so that is one of the things that we definitely have embarked on. And in our celebration on Saturday, we brought in a physician who is actually an infectious disease expert. He was on a panel with Dr. Johnson and one pharmacist from King's College, London, who is pharmacist Susan Thomas. So we brought them together to have a collaborative discussion, a panel discussion of pharmaceutical care and improving the lives of patients in hospitals. because pharmacists can also be clinicians. There are a lot of pharmacists. Dr. Johnson is a clinical pharmacy specialist. So you have to work with the doctor side by side. So the doctor says, go and do this test. This is what I am suspecting. And the test comes positive. And the doctor administers medication. So the pharmacist look at the medication now. What is the age of the patient? What is the dose the patient is supposed to take? How long does this patient supposed to take this medication? Are there any adverse drug reaction that will occur upon taking this medication? How do we observe this patient on all of this medication that he or she is on? Or if this medication is not going to be possible to be administered, how can we change it to the best alternative? The physician cannot tell you this.
Yeah.
It is only the pharmacist, and the clinical pharmacy specialist is the only one that can tell you this. So if the nurse comes, the pharmacist can educate the nurse on the medication, the side effects. Some medications, you take it, for example, your urine color changes.
Yeah.
But you should not be afraid, because it has already been told to you that this will happen. So all of these side effects and adverse drug reactions and the age of the patient, probably a very young patient or very old patient, or maybe a patient that has an organ problem. So all of this the physician will not look at. But the pharmacist knows the medication properly, how to use it, when to use it, and on whom it should be used. So if that pharmacist relays that information to the physician, and the physician sees it as a best practice and say, okay, let me change this medication, and explains properly to the nurse, because the pharmacist and the physician will not be in the ward with the patient. It is only the nurse that will be there. So this collaborative action was what actually we had as a panel discussion on Saturday. And there were very, very good information that came out of this panel discussion that we are going to push forward in our next steps of discussion. So collaboration is very important, and that will make that trust to be built by the community for all of the health workers within the country.
Okay, we are running up now. I think our friend Kama on our Facebook page says, are there any plans to publish the list of reliable pharmacists on a portal access to information? I think it's seriously, and also Doc, just recently the medical Delta, council, and shut down some healthcare facilities in the Western area. I think it was 5 of them, and then they made about 7 arrests on that day. So how can we be more proactive into that? Because that is a way of getting the professionalism, the qualification, for us to have a better healthcare facility in the country.
Obviously, the Pharmacy Board of Sierra Leone publishes a list of all licensed pharmacists for the year. And this is usually gazetted in the government gazette in the month of January or February for the previous year. I don't know what the situation is now. I believe that list should also be available on the Pharmacy Board website. That website was developed about 6-7 years ago. So that website hopefully should be functional. So if the caller wants to know, as long as a premises has been licensed by the regulatory agency, we are to assume that they meet the standard. Of course, we have what we call post-market surveillance and enforcement, which is an example of what the Medical and Dental Council did. Invariably, those clinics were being run illegally. They were not licensed, or possibly they didn't have qualified personnel. This just goes to show you that the problems are everywhere. And Sierra Leone in particular, where unfortunately, even among professions, today it's all about the money. Nobody really wants to do the genuine thing to make sure the betterment of the country or the community is achieved. It's just about get quick rich syndrome. That is why, all the more reason why you need strong regulation, strong enforcement, and community involvement. We have seen scenarios where peddlers and illegal quacks have been arrested. The very community that the police and the enforcement agencies are trying to protect, they are the same ones who come and fight you to let them go.
I know.
So we need to change. I call it, this country, we need social re-engineering. We need to change the mindset of people for them to understand that once regulations are put in place, there can be no quality without a certain level of standardization. And it comes at a price.
Okay, I think there are so many comments. Let me see if we can able to run through them quickly. The government is the biggest employers. They have flow pharmacists in the public sector and more in the private sector is very worrisome. It tells a lot how much we prioritize the health of our people, especially the vulnerable and the poor. And that is from Donald Cole. Donald again is saying we do see the dangers around, but we give blind eyes and prioritize our selfish money-making machines rather than saving lives. Donald again, he says we are seeing more people wanting to be politicians because we showcase our politicians as rich people. We need to invest in our physicians and showcase them more as a lucrative career to motivate young people to get into the medical field without fear. I think the final one we'll take for now. Often again, it's I suggest it is the supply source must be the effect source. Let's see. I think, okay, often again, it says the post-borders issue can be addressed by the ECOWAS committee. The new Sierra Leone minister in ECOWAS parliament was meeting such health plans. He needs to be reminded. And I think these are the few comments we'll take, and then probably, Farms, you want to say your parting shot before close?
Yeah, thank you very much. One of the things, of course, we have, like you said, somebody said, government is the biggest employer.
Yeah.
That is supposed to be, it is supposed to be that way, but unfortunately, I'm not sure if for pharmacy professionals, government is the biggest employer for us, because I will tell you, even for the past 2 years, no pharmacy professional has been employed into the government service. We are still fighting a kind of like battle to just be employed as a pharmacy professional to serve in the government for 2 years now. So that battle is still going to continue, and we are going to push that until we see that those cases are being resolved. But like Dr. Johnson said, licensed pharmacies and pharmacy professionals are gazetted every year. So if you want the gazette, it's available. And if you go to the website of the Pharmacy Board of Sierra Leone, or you have right of access to information, you can also go to Pharmacy Board and ask for the gazette. It's not a secret document because it is there, the name of the professional, the number of every pharmacy professional has a number. So your name, your number, where you are working, and all of that, they have those information shared every year. So if your name is not there, it means you were not licensed the previous year that actually passed. So every pharmacy professional is regulated.
All right. Yeah. Thank you very much, pharmacist Samuel Saidu. And Doctor, your parting shot?
You know, in a way, we are very right. As a nation, I think we need to change our policies with regards to healthcare, in the sense that government is the largest employer of a certain type of healthcare professional, not in pharmacy. But you see, in order for us to encourage the private sector, think about this fact. I can assure you, no study has really been done, but based on anecdotal reports and the way people access healthcare, the amount of money people spend on health in the informal sector may be either equal to or even more than what people spend seeing a formal health sector service delivery. And this is what we need to change, because we spend so much money on quackery that the end result is you don't get well, you've wasted that money, and at the end of the day, it is the government and the people that suffer.
Yeah.
So we need to put in place proper mechanisms to ensure that people go to properly, officially recognize, even at the low level. I mean, the worst case scenario, the thing is, when you go to a pharmacist, you don't pay consultation fee.
Yeah.
Worst case scenario, at least you get good quality drugs. With free healthcare, you don't pay. People are not even aware that if I go to the government hospital for pregnant women and children, where most of the medicines are spent, even if there's no medicine there, at least I'll get a proper information.
Yeah.
And then I can go and buy my medicine from a proper place. So instead of spending all these resources, I'll give you one example before we go. The average woman of childbearing age in this country, they like to abuse antibiotics.
Yeah.
Because, they say, going to make her see me time fine. The average cost, they must spend 2,000 or 3,000 every month for buy Flagyl or Septrin. Waste of money. And we just keep selling. Imagine if there are 1.5 million women of childbearing age, each one of them spending 2,000 leones on a medicine every month that they should not be spending. Let's say half. Let's, okay, be conservative.
Yeah.
Let's say 500,000.
Of them.
Some of you are even guilty because you are the guys who give them money to go and buy this thing. You know how many we are spending over 3 billion leones every month as a country on medicines that women should not be taking. So what are we doing? We are fueling the economies of China, India. We are fueling the pockets of the drug peddlers because they can just go in a corner and go buy 10 Septrin or 10 Flagyl from us see me time fine. It's just one example. Do you know how many types of medicines people take in this country that they shouldn't be taking? So this is where the problem is. Put appropriate policies that will encourage healthcare practitioners more into the private sector at a lower cost. Because here you are, I'll give an example from us as a pharmacist. You open a pharmacy today, you have to pay rent.
Yeah.
You have to employ a pharmacist. You are paying no less than maybe 10, 20 million on rent. Yeah. You are paying the pharmacist 4, 5, 6 million. Every month, you are paying other staff, you are paying tax. And you have to compete with a drug peddler who is outside your door, who is selling more than even you in the pharmacy. So how is this going to encourage private sector growth? So these are some of the issues, you know, we have to start looking at.
I know, Doc. Thank you very much, Doc, and Dr. Wisha Johnson. Thank you very much for being part of the show, and also pharmacist Samuel Saidu. We have been discussing about the World Pharmacist Day, and day that was commemorated and on Saturday as the International Pharmacist Day on the 25th of September. We will definitely get a conversation like this because it's very important, Doctor. I know, proper education should be at its peak, more especially for people in the deprived community, even us in the country's capital city also need some education like this with regards to our health care facilities. So this is where I'll bring to an end this edition. Many thanks to our Facebook followers and those who sent in their message, and thank you very much. And also thanks to those who have been listening to us on the radio 11.7, watching us on TV on Channel 33. Many thanks to the production team, my producers and technical team. Till tomorrow for another edition of This Day. Do have a lovely day and bye for now.